Hi again, I'm George Liakeas here at Lexington Medical Associates. We wanted to throw out a few videos so that people can click on them, answering some frequently asked questions. One of the most common questions, in addition to should I get tested, is what can I do to protect myself? I'm going to ask some of the other people here in our office to give some of their advice. Everyone has someone who told them something like vitamin A, vitamin B, vitamin D, vitamin C, zinc, maybe elderberry, maybe not elderberry. A lot of these things are unclear, probably not a bad idea. I'm not so sure if it's obvious how to condone or support some of these things, except to say that it's not a bad idea. However, it is even more important to rest, stay healthy, perhaps meditate, diet and exercise, and do all the things that you would do to not get sick at this critical time where getting sick on top of being sick or not being healthy would be very dangerous. I would like to introduce Dr. Michael Calabrese, a chiropractor here at Lexington Medical, to tell us some of the things that he does.
Hello, my name is Dr. Michael Calabrese. I'm the chiropractor here at Lexington Medical. We advise everybody to stay at home and practice social distancing. However, a lot of people are going to become restless at home and you're going to be off your normal daily routine. So I think it's very important that although they tell us to stay home, you should still try to go out and get a little fresh air. Just practice social distancing. Make sure you get up off the couch or whatever you do, just make sure you get exercise and stay flexible. I know a lot of you go to the gym, a lot of gyms are closed now, so what I would recommend is going on YouTube and just putting in whatever you want to do, yoga, Pilates, calisthenics, etc., etc. There's tons of free videos and you can just then exercise right in the comfort of your own living room. This is what I've been doing. I don't know how people feel about this, but I have been going down. These are condensed vitamin powders. They sell them at GNC or any other health food store. You take one scoop, you put it in the water. It's real easy and you get tons of vitamins and nutrients. It helps with your immune system and helps you to stay healthy. So I like this brand, good, Amazing Grass. I'm not endorsing anything here, but there's another one called Vibrant Health. But these powders are really easy to do. They're very cost effective and they keep you really healthy. With that said, please don't panic, and we're here for you. If you guys have any questions, feel free to call. Take care, be safe, be healthy.
Another thing that people are asking about are some of the different medicines, like a Z-Pak or an antibiotic. COVID-19 is a bacteria, and although the worst cases are potentially dying of pneumonia, it is not clear that taking an antibiotic during an infection or during at least the early stages of an infection will help. I'm not so sure, or I'm sure that hoarding Z-Paks and antibiotics will probably not be important, because if you are feeling that ill, you should consider going to the emergency room. The other things like chloroquine, which is a malaria medicine, ribavirin, or Kaletra, or interferon, or other medicines that are being discussed, while promising and useful to know about, they have a back order. And those patients, like so many of our patients, who want to get it for them because they have symptoms, do not appreciate that we don't know exactly yet how to prescribe it, what are the risks versus the benefits of those medicines, and therefore, until the medical community has a better statement, I would not necessarily think it's relevant to hoard these medicines, since most people, like 80% of people with COVID-19, get better before they even know they tested positive. A vaccine is in the future, I am certain. It probably will take closer to a year, as it takes more than just a vaccine development to encourage mass distribution of a vaccine. But herd immunity, which will occur as many of us get it, will help us stop and slow down the spread. The more of us that get COVID-19, the fewer number of people are out there that can get COVID-19 again. I would like to introduce Kendall Liakeas, a nurse practitioner here at Lexington Medical Associates, to tell us some of her frequently asked question answers.
Hi, I'm Kendall Liakeas, and I'm the family nurse practitioner here at Lexington Medical Associates. I'm going to go through a couple common questions that I get asked from patients. First, what if I'm pregnant and I get the virus? It appears that the virus does not affect the fetus, and it cannot be transmitted through breast milk. Another common question, can I get it again? We do not entirely know the answer to this question. What we do know is when the human body is infected with the virus, it creates antibodies that help protect the body against repeat infections. The viruses can also mutate, usually becoming weaker, not stronger. So a second infection should be less severe than the first infection. Remember, the virus is similar to the common flu in severity, lasting about 7 to 14 days. But we must all do our part to protect those who do not have strong immune systems and protect our hospitals from becoming overcrowded by staying home and washing our hands, even if we are healthy.
Again, everybody needs to protect the elderly and the vulnerable, as they are the most at risk. Everyone else will likely get through this just fine, whether they get exposed or not to COVID-19. Here is Paul Hogue, a physician's assistant with the Lexington Medical team, to tell the Lexington Medical family some of the FAQ answers that he has and share his insights on COVID-19 and the calls that he's been getting.
Hey everybody, it's Paul Hogue, one of the PAs here at Lexington Medical and one of the providers here. I just wanted to talk to you a little bit about other things that are going on in these times and just helping you to understand that we're still here for you, because remember, strep throat, flu, belly aches, other aches and pains, and things like that don't take a break for illnesses like coronavirus. And while most people's focus right now is on the pandemic that's going on and concerns about that, we want to make sure that you understand that we're still here for you if you have those other concerns. We want to make sure that you stay safe and healthy and that we get you better, even if it means talking to you on the phone about your symptoms, helping to treat your symptoms and things on the phone. Or we're here, and if you need to come here in a safe way, we want to make sure that you know that you don't have to wait just because you think you might be taking up some space because of people who might be concerned about the coronavirus. So you have our number, let us know, we'll be here. No, we're not going anywhere at the moment. And stay safe. And most importantly, I'm getting a lot of texts and calls and phone calls and family members, friends, patients who are concerned. They're very anxious because there's a lot of news that's out there that's making them worried about what's going on. And I'm urging all of my friends, family, and patients to try to take a deep breath. Try not to take a deep breath if anyone's cough, as you know what I mean, but if you can try to take a deep breath and think for a few minutes about where you're getting your source of information. And if it makes you anxious, again, try to feel free to let us know and try to get your news from sources that are really giving you the up-to-date information from places like the CDC and other agencies that are really at the forefront of the developing news on this. And we're keeping track of it, and we actually have a lot of information based on the patients we've seen here, some of the cases that we've seen, that we can help to add to the discussion and help to keep you at ease during this time, because I feel like most of the information that's coming out that I know has been very positive, and I want to keep everybody as measured as possible so that we can get back to normal life, keep everybody safe, and try to get past this, okay? So absolutely feel free to reach out to us. We've been here, we've been seeing sick people, we've been doing okay. I'm still here, Dr. Liakeas is still here, Kendall's still here, Colleen's still here. All of us here at Lexington Medical are feeling well, and hopefully that'll make you feel a little bit better, that all is not over and there's not, too much doom and gloom going on. We really don't feel that way, okay? So stay healthy, we'll see you soon, and let us know if you need us.
Again, thank you everyone. We do remain open to answer questions and assist those in medical need. I do want to thank my staff for tirelessly answering phone calls. We are exhausted also. but we understand the fear that is going on in these uncertain times. And we'd like to remind you that we are here for you, but I hope and ask that perhaps some of these videos can answer your questions so that we can triage the calls a little bit more easily. Thank you.